Before placing the Hoyer sling, you need to first assess the patient's height and weight, and then you can select the appropriate size of the Hoyer sling for the patient. The sling should support the head, thorax, and buttocks. There are typically two types of slings that are used. The mesh sling, which is shown in this picture, is typically used in a hospital setting, so the patient is able to take home the mesh sling and use in their own home. And then there's also a U sling that is shown in this picture that is also used by physical therapists for the Hoyer lift.
First thing you want to do before moving a patient in the Hoyer lift is to first ask for their consent. Kelly, do you mind if I move you in the Hoyer lift today? Okay. So now what I'm going to do is I'm going to move the patient to a side-lying position. You can refer to skill 2 for this. From here, you're going to add the sling to the bed. You're going to fold it in half. You're going to make sure that the folded part is going to be right here closest to the patient. That way when you roll the patient back to the other side, it's easier to access and make it flatten. You want to make sure that the base of the sling is at the base of the spine and that it supports the upper thoracic area. So then you move the patient back to supine. And then you're going to move them to sideline to the other side. And you want the patient to be in the midline of the sling for their protection during the transfer. And roll them back to supine. Next, after the patient is in the midline of the sling, you want to cue the patient to cross their arms for their own protection during the transfer. And then for the lower extremity, you want to bring the sling from lateral to medial and wrap the lower extremities. And then with the straps, you're going to cross them. From here, you're going to move the Hoyer lift itself over the bed, and you want to make sure that the base is as wide as it can go and that the lever is in a low position so you can attach the sling to the spreader bar. So now you're going to cross, so after you've crossed the straps, you're going to attach them to the spreader bar one side at a time. After the patient has been transferred and transferred back to the bed in the Hoyer lift and the straps are removed, you can remove the sling from the patient. First, you uncross the straps and then bring the sling from underneath both sides of the lower extremity. From here, you're going to bring the patient back to a side-lying position. And then you're going to fold the sling underneath the patient for easier removal. And then roll them back to supine. And then transfer the patient onto the other sideline position. And roll patient back to supine. Before placing the Hoyer sling on a patient in a wheelchair, you want to double check that the wheels are locked on the wheelchair before placing the sling. Then you also want to make sure that the patient doesn't have anything in their anterior trunk that prevents them from leaning forward. Now for placing the Hoyer sling on the patient in a wheelchair, you want to either cue the patient to lean forward to one side or passively move them. And then you're going to place the sling in the back of the patient. And then you want to, at the same time, on one side, bring it down behind the patient towards the buttocks and bring the leg strap toward the side of the leg. And then passively move the patient up. And then move the patient or cue the patient to